Hello friends, how are you? Now, today we are starting with our new topic autocoids. So, first of all, we will see what are the learning outcomes of this. Uh, Upon completion of these sessions, the students will be able to define and describe the different types of autocoids. Autocoids means what are the different types of autocoids, and they can describe where their roles and all etc. You can explain the role of histamine in your body. General, whenever the autocoid is finished, we will continue with, in this presentation, we will continue with the role of histamine in our body, what histamine is playing in our body. Classify and describe the antihistaminic agents. What are the various antihistaminic agents? We can classify them and we will describe their actions and predict the applications of the antihistaminics. What are the various applications where these antihistaminics are used? Okay. Now, first of all, we will start with the autocoids. So, what are autocoids? Autocoids, here, this autocoid word itself is divided into two parts: auto and cos. Auto means self or automatically, and remedy. So, body has its own defense mechanism so as to repair the various attacks which are made in our body, and to do that they have some system inside our body which is called as autocoid. So for example, we can say this defense mechanism or indicating mechanisms are like if you are having some bee sting or ant sting in our skin, then there is a inflammation, small inflammation, there is a infection, not infection directly, the infection can be a secondary inflammation or triple response, itching is there, redness of that spot. So this all happens as a outcome of a release of autocoid over there. So it is giving you a self kind of a remedy over there. So what the autocoids are? Autocoids are also called as local hormones. These are the local hormones. They are released at a particular site, and where they are released, their action is there on that particular site only. Typicality of the hormone is that they always release at one site and they travel by the systemic circulation and they act at the other side. But here, the autocoids are released at a particular site and they are giving their action in their vicinity only. Their actions are very short duration. Endocrine system we are knowing very well, they are for the long duration of action. Okay, but here many times the endocrine system or the hormones of the endocrine system give you the action for throughout your lifetime. But here these actions of the autocoids are very short. Whenever they will be released at in that particular time for one day or maximum few hours, they will be acting over. They produces by specific gland. Here they are not produced by the specific gland, and like endocrine system, pituitary gland, thyroid gland, etc., these are glands are there. Here they are used by some cells which are present as a WBC cell, mast cell, etc., etc., and these cells are wandering throughout your body. So it is not like that it will be secreted at a particular area and will acting on a particular area. It is not like that way. So everywhere they will be present and everywhere they can be released, but where they are released at that particular point only, it will show you the action. So generalized action of autocoids are very short, not transferred in the circulation, as they are working under specific released by the specific cells only and giving you the localized action. So they are not transferred in the systemic cell most of the time. Very few of the time where there the actions like anaphylactic shocks and all that, at that time they may be transferred at some distance, but not at almost, it is not a thumb rule that they will be transferred. Do not act at the distance, as they are not transferred, they are in the circulation, they will not act at the distance. They are also involved in the physiological as well as pathological processes. Like your gastric acid secretion is regulated by H2 receptors. Histamine secreted and acting on H2 receptor. So they involve the physiological process. Okay, inflammatory responses like coagulations. So these processes are involved in the physiological, whereas the antigen antibody reactions were the pathogenic processes. So autocoid mainly act plays a very important role in physiological processes as well as the pathological processes, whereas the hormones play the only role in your physiological process, not in the pathological processes. So this is the typical difference between a your endocrine hormone and autocoid. So they are also released during the allergy, hypersensitivity, inflammation, etc. So these are the different types of autocoids. depending upon their chemical structure and types, they can be differentiated like this. Amines, here the first amine we will study over here, that is histamine. Then the second amine is 5-hydroxytryptamine. They are synthesized from the amino acids. Seconds are the lipids like prostaglandin, leukotrienes, interleukins, platelet activating factors. Then peptides like bradykinins, angiotensin, and thromboxane, cytokinins, and substance P. So these are the different types of autocoids which are found in. This is the only few important of that. There are many like nitric oxide and etc. etc. But most important we have listed over here, and rest of the other we will see whenever in the next presentations. So very first autocoid we will start with the histamine. So it is also known as a tissue amine. Histos means tissue. So the amine which is present in a tissue, it is called as a tissue amines. Okay. So these are the present in animals as well as plant. They are also found in the plant cells. Okay, animal cells as well as plant cells. So abundantly they are found in human beings also. They are present in stored in the mast cell. Mast cells are the cells which where they are synthesized and they are produced and stored over here. And whenever they will be required, they will be released. The rich tissues which are present in our body is the skin, gastric, intestinal mucosa, lung, liver, and placenta. So skin, where most of the time the reactions will be shown, like if you are having ant bite or something like that way, or some damage to the particular thing, it becomes a raid. So it is nothing but the release of histamines and different autocoids, majority of the histamines, but other autocoids are also released over there. There is secretion of a gastric acid. There is but through the intestinal mucosa. There is inflammation in the lung. There is inflammation of a liver. Okay, the placenta, which is necessary for the maintenance of a pregnancy. So these are the substances. The histamine is present abundantly. It does not mean that they are not present at other site, but these are the site where they are abundantly present. So these are the non-mast cell histamine is also present in the brain and epidermis. Uh, Brain also contain the histamine, but they are not present in the mast cell. All other like skin, gastric acid, mucosa, intestinal, liver, they where the mast cells are stored over here. But mast cells are not abundantly found in your CNS. So therefore, they are non-mast cell histamine is also found in the brain, where it acts as a neurotransmitter also. It is also present in the blood, body secretory, venoms. Venom is a pathological fluid which is secreted by the different plants or animals. And whatever the reactions we are getting whenever there is a venom incorporation inside our body, we are getting the different type of reactions due to this presence of histamine. Histamine is one principal component of the venom. And the pathological fluids also contain the histamine. So this is the synthetic pathway of the histamine. It is synthesized locally from the amino acid histidine. Histidine is the amino acid from which the histamine is synthesis. This is the histidine, and there is a L-decarboxylase. This carboxylase is removed. Carboxylic this it is removed over from here, and it is the amine which is present over here. Histamine. This is histamine. So it is synthesized from the amino acid histidine. Degraded rapidly by oxidation and methylation. These are the degradation pathway here by oxidation and methylation. These are the two pathways by which it is degraded. After synthesis, either entered, either stored or metabolized. So it is go into the mast cell and stored over there, or it is directly metabolized in giving, because the action when it is released out, its action is very short. थोड़ी देर के लिए बहुत ही एक्शन दिखाता है एकदम so immediately it is getting metabolized. Either it is stored or immediately give the actions and metabolize. Mast cell is the chief storage site. Basophil, enterochromophil cells. These are the sites where it will be stored, and also found in the neurons in the CNS. Nerves के अंदर भी ये पाया जाता है, and here it act as a neurotransmitter. So what are the roles of histamine in our body? So histamine plays a different kind of a roles which are listed over here inside our body. So in the immunologically immunologically it is one of the principal role. So as it is going further, तो सबसे पहला जो main important role is at the top. So immunological release. So histamine is released whenever there is a immunological release. So sensitize the antigen antibody reaction on the surface of mast cell. So Whenever there is a entry of antigen inside our body, uh, it sensitizes the surface mast cells and releases the antibody. So antigen antibody reactions, whatever these are, where the histamine is released. So it is also released by the degradation of basophil and mast cell. So after release of this histamine, this degradation of basophil takes place. Okay, degranulation, not degradation, degranulation means the cell breaks down. So the granules which are present inside the cell, they will be released out. So where there the histamine is stored, histamine is stored inside the granules. So when the cell lyses, this granules will be released after healing. So it also releases the other mediator. The histamine release also stimulate the release of kinins, 5-hydroxytryptamines, prostaglandins, leukotrienes, substance P, which is responsible for pain and all these things. So these are the neurotransmitter. Autocoids can be released by the histamine. Second major role it plays is that inflammatory reaction. So it produces local vasodilation and leakage of the. So it causes a little bit inflammation of the cells. So due to that cells, little bit the permeability of the cell membrane is increased, and due to that leakage of the plasma will start. So plasma will leak out from that, and there is a local vasodilation. So there is a dilation of the blood vessel in the local area. So due to that, the flow of a blood in that particular area is little bit increased. So but this vasodilation is localized one. Okay, chemical and mechanical induced released. So many times what happens, that some chemical impact or mechanical impact, if it is there on your skin, like release of some chemical, or some chemical like your bees, or bees bite, or wasp bite, or bee stings, mosquito bite. So there is a release of some chemicals from that bite, and some mechanical hammering like this, if it is taken. So there is a inflammatory reaction which is taken place, and this where the histamine is playing the important role. Now next is the gastric acid secretion. So it is one of the main important physiological role of the histamine. It is a powerful secretogen, releases HCl from the parietal cells through the H2 receptor. So involvement of H2 receptors are there. So it induces the secretion. Whenever there is a histamine release, it induces those. So gastric acid secretion is in. So it also regulates over there inside our body. The whatever the normal hydrochloric acid is secreted, it is influenced under the histamine. So in CNS, it also plays a role of a neurotransmitter. It increases the arousal. So whatever the arousal response you are getting, it is due to the this histamine as a neurotransmitter. Wakefulness it increases. H1 receptor is also found in the cerebellum, hippocampus, thalamus, and hypothalamus. So histamine also plays an important role in a CNS, and in a CNS arousal response, wakeful response, and also in the various regions like cerebrum, the histamine receptors are found. So definitely it clearly indicates that histamine is playing a significant role in CNS also. So what is the action of this histamine on cardiovascular system? First of all, so if we inject the histamine directly inside the bloodstream or something like that way, if you are doing like that way, then it dilates the blood vessel, which is leading to the flushing. So blood vessel will be dilated and flushing response you will get. Okay, so decreases peripheral vascular resistance. So due to the dilation of a blood vessel, the peripheral vascular resistance will be decreased. But here I want to point it out that by decreasing the peripheral vascular resistance does not mean that the histamine can be used as an antihypertensive agent, because it also along with this there is also other responses which might be painful for you. So like it may induce the anaphylaxis reactions, or it may improve the inflammatory reactions. So definitely by this action, like decreased peripheral resistance, you may expect that histamine can be given as an antihypertensive agent, but no, it does not have such a clinical importance. This is the action, it is not an importance. Okay, so it decreases the peripheral vascular resistance, involved both on H1 and H2 receptor, increases capillary permeability. So capillary permeability will be increased. So transfer of a fluid across this capillary membrane will be improved. So leakage of plasma fluid in extracellular fluid. So cell will be inflamed. So definitely due to that there is a leakage of the plasma protein. So the flow property, that restriction of the plasma membrane will be reduced, and due to that what happens, the plasma protein will start leaking out from the membrane. Okay, increase the lymph flow, edema. So there is accumulation of a fluid outside, and lymph flow will be increased. So increased contractility and pacemaker activity, and this is due to the H2 action, H2 receptor action. So contractility of the heart will be increased and pacemaker activity. So heart rate will go on increasing. So these are the actions of the histamine on the CVS. Second is the anaphylactic shock. What is the role of anaphylactic? It releases in the large quantity during the anaphylactic reaction. Large quantity throughout the body, this will be released in during the anaphylactic reactions, and this is due to the fail in the blood pressure. Due to the vascular resistance decrease, it will lead to the severe fail in the blood pressure. Contribute for the other feature of the whatever the other features of the your shock is there. Histamine plays a very important role in it. Sorry. Also in bronchial asthma, histamine plays a very significant role, causes the severe bronchoconstriction. Histamine constrict the bronchi, and this action is mediated by the H1 receptor. H1 receptor mediated vasoconstriction it leads to the. So patients are highly sensitive for the action of the histamine. So bronchial asthmatic patients are highly sensitive. If they are histaminic patients, sorry, asthmatic patient, if he is go into the area where there are large fumes are there, और some सेंट इज दैट सेंटेड इन वेरियस और जहाँ पे कोई अगरबत्ती वगैरह लगी तो इस एरिया में अगर हिस्टामिनर्जिक पेशेंट अनाफाइलेक्ट सॉरी अस्थमेटिक पेशेंट जाते हैं तो वहाँ पे ब्रोंको कॉन्स्ट्रिक्शन एंड दे मे प्रेसिपिटेट द दिस इज ड्यू टू द सेंसिटिविटी ऑफ द टुवर्ड्स द हिस्टामाइन. हिस्टामाइन रिलीज होता है वहाँ पे और इमीडिएटली इट मे फील द constriction inside the bronchi. So constriction of GI tract, particularly in the small intestine, it will may reduce. Contraction of smooth muscle of a uterus, so it may induce the labor, but which does not have any clinical application as such. So contraction of a smooth muscles of a uterus, it may give. It gives a typical type of a response which is called as a triple response. This is one of the most important action which is given by the histamine. Okay, which includes the flush, flare and wheal. These are the three responses which is also called as a triple response: flush, flare and wheal. Flush means what? Localized red spot where there is, if there is a ant bite over here, there is a sting over here, that it is a localized red spot over a few millimeter, and which is leading to the vasodilation in that particular area, which is called as a flush. Next is a flare, a bright red spot around this 1 centimeter. उसके आजू बाजू में redness हो जाएगा. ओके, हिस्टामाइन इंड्यूस द स्टिमुलेशन ऑफ एक्सॉन. एक्सॉन वहाँ के नर्व एंडिंग से वो स्टिमुलेट हो जाएंगे और वहाँ पे हो जाएगा रेड स्पॉट हो जाएगा. And will, there is a discreditable within 1 to 2 millimeter around the red spot, plasma leakage and extracellular. So there is a will means there is a elevation, inflammation over there. So 1 से 2 mm एरिया में क्या होगा? रेड स्पॉट होगा और वहाँ पे फ्लूइड एक्यूमुलेशन, सूजन आ जाएगी. रेड स्पॉट बाहर बहुत सारे एरिया में आ जाएगी लेकिन एक जगह पे सूजन आ जाएगी. So this is called as a will. Okay, so flush, flare, will. This is a typical response of the histamine over here. And at the nerve ending, if it is given nearby the nerve ending, it causes the intense pain or itching sensation. So these are the typical actions of the histamine inside our body. So next part is a histamine and agonist. So what are the agonist actions of the histamine? So as such, clinically it does not have much applications in histamine. Very few applications are there. Histamine agonist. Pulmonary function test is one typical test which is done by the using the histamine agonist. So aerosols are used to provocation test whether the histaminic agonists are working over here or anaphylactic reactions are there or not. So it is a provoking test. So very rarely it is used. So testing the gastric acid secretions, many time patient may have achlorhydria, that is absence of gastric acid secretion, and to check whether there is a gastric acid secretion is normal and is there any deficiency of histamine or is there any other reason behind the achlorhydria. So whenever the gastric acid secretion ability of the patient is highly reduced, at that time it is checked by giving the by giving the histamine agonist. So it is also used as a diagnostic test for pheochromocytoma, causes release of catecholamine from the adrenal medulla. So whether the patient is having pheochromocytoma or other condition due to which there is a elevated catecholamine level, to test that the histamine agonist are also given. It is not preferred preferably because it causes the alarming rise in the blood pressure. So due to that, it is not preferred, but it is one of the taste which is used. Okay. To test the allergic skin testing as a diagnostic agent, it is also used. So it is also known to causative agent responsible for the reaction. Anaphylactic sorry allergic test देखने के लिए use किया जाता है. Serum histamine, urinary histamine or metabolites are tested. So serum sample or urine samples, they are also analyzed for the presence of histamine. Okay. Next is a histamine antagonist. Histamine antagonists generally work by the three mechanisms over here. One is the physiological antagonist. Second is the antagonist which prevent the release of histamine, and second is the antagonist which are work at the receptor level. Okay, so physiological antagonist means they are having the opposite action as that of antihistamine. One which prevent the release of histamine, and second is they does not act on either physiological or they prevent the histamine. They work at the receptor H1 and H2 receptor. So these are the by these three way we can get the antagonism of the histamine. Okay, so depending upon the different type of histaminergic receptor, these antagonists can be H1 antagonist and H2 antagonist. H1 antagonists are conventional antihistaminic agents, which whatever we are knowing is that H1 antagonist. H1 antagonist. Okay, and H2 antagonists are anti-secretory agents. Okay, like an antacid. So this H2 antagonist, it is out of scope of this our study today. So H2 antagonist we will study as a separate chapter over here, and antacid, gastrointestinal agent. So at that time we will see as an H2 antagonists like ranitidine and cimetidine, all that. So traditional antihistaminic agents are nothing but your or conventional antihistaminics are nothing but your H1 antagonists. So they are also called as a conventional antagonist. Competitively block the H1 receptor. So they compete for the H1 receptor over there, and effectively depending of effectiveness of the tissue depend upon the tissue where these tissues are present, how many number of H1 receptors are present over there, and effectivity depend upon that. H1 antagonist does not mediate the action through H2 receptor. So H2 receptor mediated actions are completely different category, like your gastric acid secretion and all these things. And anaphylactic reaction, these histaminergic reactions are H1 mediated. So what are the actions of this H1 antagonist or conventional antihistaminic agent? So on smooth muscle, they inhibit the bronchoconstriction. So bronchoconstriction, which is induced by the histamine, is inhibited effectively by this antihistaminic agent. They block the vasodilation and peripheral capillary permeability. They will be reduced over there. They effectively block the triple response, flush, flare, and will. This triple response which we are getting due to the action of histamine, they effectively block. So bronchoconstriction, capillary permeability, vasodilation, and triple response are effectively blocked by the antihistaminic. So in anaphylactic reactions, these antihistaminics are given. They block the anaphylactic reaction, the release of mediators. The histamine also involved in the release of other mediators like kinin, cytokinins, leukotrienes. So they will be blocked by the action of antihistaminic. They reduces edema and itching by the hypotension. The histamine induced hypotension, histamine induced edema or itching responses, they are so effectively blocked by the antihistaminic agent. Now, what are the actions of this antihistaminic agent on the CNS? Okay, the first generation H1 antagonists also have the sedative action. So typically antihistaminics which are from the first generation have the sedative actions. So they depresses the CNS alertness, and reaction time is increased. So you to give the response you take a more time, your alertness is decreased, you are a little bit sedation. So this kind of effect the first generation antihistaminic agents are given. Second generation histamine does not crosses the brain barrier, and therefore they do not have the CNS effect. So second generation जो newly synthesized antihistaminic agents are there, they do not cross the blood brain barrier, so obviously the CNS effect is little bit less, so they do not have the sedative action. Okay, so this kind of a side effect we can say they are devoid of. Okay, second is an anti-emetic action. Promethazine is effectively used in the treatment of motion sickness or pregnancy related related vomiting. So pregnancy related vomiting or motion sickness kind of a drugs, if there is a problem with the patient, that promethazine is the drug which is used. So what is the mechanism of action? It is not clear, but it antagonizes the histamine and muscarinic property. So it is having the anti-muscarinic action, typical anti-muscarinic action, and due to that, it is producing the antiemetic action. This antihistaminic also has the anticholinergic effect. This is one of the typical action of a antihistaminics. Most of the first generation have the ACH mediated responses, which are from M1 and M3 receptor. So this first generation antihistaminic agent also act on M1 and M3 receptor, and they block the ACH mediated actions over there. Okay, produces atropine type of actions like dryness of mouth, constipation, blurring of the vision. So these may contribute for the side effect of the antihistaminic over here: dryness of mouth, constipation, blur vision, urinary retention. And these actions or these side effects, atropine type of side effect, are contributing for the what we can say side effect of these antihistaminic agents. Next actions are anti-Parkinsonian effect. H1 antagonist, diphenhydramine antagonist, the extrapyramidal side effect. So extrapyramidal side effect, these are the antipsychotic drugs also produces this kind of a reaction. So to minimize that, H1 antagonist can be given. So they are also produces local anesthetic effect. Promethazine have a significant local anesthetic agent. So they act as a potentiator for the procaine. MAO mechanism of action is the sodium channel blockers. So by blocking the sodium channel blocker, they prevent the impulse conduction over there. Next is the serotonin blockage. So cyproheptadine is the known as a 5-HT blocker. Along with the antihistaminic action, it also blocks the H1 receptor, and cyproheptadine is mainly used in the treatment of allergic. They also block the adrenergic receptors. Promethazine effectively block the alpha receptors and produces the orthostatic hypotension. So behind the production of orthostatic hypotension, this has antihistaminic agents are responsible. Next is the pharmacokinetic parameters. What are the various pharmacokinetics parameters of it? They are absorbed well. All antihistaminic agent, conventional antihistaminics, are absorbed well. Peak plasma level reaches within 1 to 2 hours. That effect lasts for 4 to 6 hours, so 3 times a day, generally 2 times or 3 times a day it is required. Widely distributed throughout the body, so wherever it is required they will be distributed. So plasma volume of distribution is very wide. First generation agents crosses the blood-brain barrier and show the CNS effect, may contribute for the ear side effect also, like drowsiness and sedation type of effect. So extensively metabolized in the liver, they augment for their own metabolism, so limit their therapeutic effect. So they stimulate their own metabolism in the liver, so their therapeutic effect, they are self-limiting. So some agents are converted to active metabolites, so they may produces the fetal arrhythmia. So the metabolite which is produced are active and therefore may produce, so accumulation of a drug and fetal arrhythmia they may lead to. So drug interaction type of things which is happening along with the antihistaminic, they causes the consequences of drug interactions, potentiate the CNS depressant effect, because first generation crosses the blood-brain barrier, enter in the CNS and show drowsiness type of CNS depressant type of action. So potentiate the depressant type of action. Potentiate the MAO oxidase inhibitor actions due to action on the liver. Exacerbate the anticholinergic effect, because antihistaminic also has the anticholinergic effect, so they exacerbate these actions. Decreases the effectiveness of cholinesterase inhibitor, because it has act as an anticholinergic agent, so therefore cholinesterase inhibitor actions will be antagonized due to anticholinergic action, hence not used in Alzheimer's diseases. Side effect and toxicity, H1 antagonists are well tolerated. As such, in the clinical therapy, they are well tolerated. Side effect are mild, but frequent they are. So individual shows a marked difference in the side effect. Some person may be highly susceptible, but other may not be there. So tolerance to the side effect develop upon the repeated dose. A repeated dose will lead to the development of tolerance. Avoid regular use in the children's, because it causes the severe CNS depressant, specifically first generation. Common side effects are sedation, diminished alertness, concentration, have high concentration may lead to the headache, motor incoordination, fatigue, tenderness, etc. These are the common side effects which are observed over there. Impaired psychological psychomotor performance, whatever the psychomotor performance like driving skill or operating the heavy machinery, it required the psychomotor performance and it is impaired. So it is always advisable कि whenever you are taking an antihistaminic agents, you should not drive the vehicle or you should not operate heavy machines. So they also produces dryness of mouth, altered bowel movement, urinary hesitation, and these are all due to the anticholinergic action. Epigastric distress, headache, it is the local dermal actions. Hydrazine, cyclazine, they also known to be teratogenic, but no evidence has been found in the human. So acute overdose also produces the CNS excitation, tremor, hallucination. So if you give an acute high dose, so these side effect you may feel. Clinical applications, these are the applications where clinically they are used. So very widely used and very effective used in allergy. So effective in rhinitis, urticaria, conjunctive itching of the itching sensation, hay fever. So these are the typical allergic reactions where these antihistaminics are used. Do not suppresses the antigen antibody reactions. They act through the H1 receptor. They do not, they provoke the antibody reaction, but they antagonize. So H1 antagonists do not suppress the antigen antibody reactions. They only prevent the H1 histamine release. So block effective release of the histamine only, which is responsible for antigen antibody reaction. So they do not produce prevent the they do not suppress the antigen antibody reaction. Not useful in acute allergic or inflammatory condition like asthma, anaphylactic shock. Asthma and anaphylactic shock, although it is reduced, but vasodilation, they are not a vasodilating action. So they are not useful in this kind of allergic or inflammatory reaction. They release the sneezing, rhinitis, itching of the eyes, nose. They are effectively in the releasing of these symptoms. Also used in dermatose, acute urticaria. So dermal infection, dermal type of things which are, so they are effectively used over there like napkin rash, uh, atopic dermatitis, like this ischemia, so drug induced rash. So they are effectively used in dermal conditions, so where their skin is involved in due to release of the histamine. If something is happening, then this kind of conditions can be reduced by the clinically corrected by the antihistaminics. So hypersensitivity reactions also can be decreased. Second clinical application is a motion sickness and vertebral disorder. Scopolamine is a perfect prophylactically used for the treatment of vomiting, motion sickness, travel sickness. Dimenhydramine, hydroxine, these are effective, equally effective for this motion sickness. Then hydroxine is also used in the management of the nervous and tensions, mental disorders. Diphenhydramine for the extrapyramidal side effect, and in Parkinsonism diseases also these drugs are used. So which will prevent your motion sickness or vestibular disorder. Pruritus, second application is a pruritus, that is itching type of sensation. And again, it is a dermal kind of a thing, which is conventional drugs like antipruritic agent also act by the H1 antagonist. Relief in is incomplete. It gives the relief, but it does not cure it completely. The first choice of drug is chlorpheniramine, diphenhydramine, like etc. Second is the common cold, do not affect much cause of the illness. So antihistaminics are given in common cold, but this, what is the cause of common cold? It is not relieved over there. It is give you only the symptomatic relief. So it is only the symptomatic relief due to the anticholinergic and sedative effect of it, but does not target the illness. Okay, newer anti sedative agents are less effective due to that, because it uh, does not crosses the blood-brain barrier. So it is just a symptomatic treatment it is given in the common cold. Next is the vertigo. Cinnarizine has been additionally anticholinergic effect and used in a vertigo. This action is due to anti-5-HT agent and sedative action. Due to that, it reduces the vertigo. Inhibit the vascular sensory nuclei in the inner ear, and by that way it acts as an anti-vertigo, suppresses the prostobronchial and labyrinthic reflexes. So by this way, it will act as an anti vertigo in the treatment of vertigo. So other condition where these antihistaminics are used is pre-anesthetic medications like promethazine due to its anticholinergic and sedative effect, cough chlorpheniramine. Symptomatic relief you can get in the condition of a cough due to anticholinergic action, and then acute muscle dystonia due to parenteral promethazines is given generally. So due to that, the anticholinergic action, it is also given in the treatment of acute muscular dystonia. So these are the clinical applications of the antihistaminic agents. So that's what about the introduction of the autocoids and the histamine and antihistaminic agents. So if you have any kind of a difficulty or doubt, you may contact in the given phone number, or you may write to me on the given email ID. Thank you very much.